So I'm Gina Kruml. I'm a women's health nurse practitioner, and I've just joined the practice here with Advantia at Women's Health Specialists, and I've joined a great team of other providers. So I'm a women's health nurse practitioner. I see a lot of women for well women visits and for problem visits, and I also do pelvic floor therapy. So that is a wonderful modality where we can really make a big difference in people's quality of life. I used to, as a women's health nurse practitioner, I would send people for pelvic floor therapy, and I would almost always see very good results from that. So based on that experience, I thought it would be very nice to provide the pelvic floor therapy for people. So pelvic floor therapy, first we start out with a detailed evaluation to see what problems are going on for a person. There's a lot of things going on down there in the pelvic floor area. So sometimes somebody might come in for one problem, but they're really experiencing more than one problem. So we find out what all is going on for that person and then tailor a treatment plan to address those issues. I think pelvic floor therapy is really worth trying a lot of times because there's very minimal to no risk with doing it. A lot of times people are thinking about, well, should they have surgery for their problem? Or do they think they might need to stay on a medication for a very long time to address what's going on? And they might find that instead of doing one of those kind of things, they would want to start with pelvic floor therapy and see if that might help their problem. And perhaps that's all that they need to do. So it might just take 6 to 8 weeks of visits, and then they'll be off and running and maybe not need to do some of those more invasive things or some of those things that might have some risks with them. So I think pelvic floor therapy is a very good thing to try a lot of times. Yeah, and it's always very encouraging to see within a couple of months people going from extremely bothered by their symptoms, and it's very much impacting their quality of life, to, within a couple of months, they are very excited to find that they're not bothered by their pelvic floor symptoms hardly at all, or maybe not at all. So a visit for pelvic floor therapy, the first visit involves a lot of questions because we want to find out what all is going on for that person. And then we go ahead and we get started with the therapy. Each visit, after the first visit, might take about half an hour. So it's not a very long visit. And we always give examples of exercises or other things that a person would want to do between their visits so that they're strengthening their muscles or addressing their issue in the way that would help them the best. I do a lot of education throughout all of the visits so that it's a very multifaceted approach, and giving people the tools to address their issue going forward even after they finish with the pelvic floor therapy. So in terms of being a women's health nurse practitioner, I find that my goal is your goal and your priority is my priority. So I always encourage people to definitely come for their yearly well woman visit, because even if it's not a year when we're doing a pap smear for them necessarily, there are definitely other things that we're going to want to address, so that if you go see your primary care provider every year and also come see your women's health care provider every year, you're going to be glad that you did that. So I have 4 children, and I really enjoy gardening and I really enjoy cooking. So those are the main things that I do on my days off. So I am accepting new patients, and they can contact the office to make the appointment with me.